On behalf of AHPGIC, I extend a warm welcome to the distinguished dignitaries over here and all the participants for the workshop. Today we have with us the Doyen of Palliative Care in India, Dr. Nagesh Simha sir, and who needs no introduction, but let me take the pleasure of introducing him to all of you. He is trained in general surgery, qualified in palliative medicine, and he is the founder, trustee and medical director of Karunashaya Hospice, Bangalore, and he is also the medical director of Bakchi Karunashaya Palliative Care Center, Bhubaneswar. Now request our medical superintendent, Professor Rekha Das, to felicitate Dr. Nagesh Simha sir.
So you're sitting in a regional cancer hospital, right? So guy would have gone to some place, somebody would have done a biopsy, and whether the patient has been told or not, the relatives will go and then they will bring here. And you're sitting in the OPD, you're very busy, you don't know how much the patient knows, whether you should break the bad news, how, what, and then relative tells you not to tell the patient, right? So there are two parts to it. One is what we call as breaking bad news, and the other one of relative telling you to hide the thing. That is called collusion, okay? So both of them happen very regularly. Do you find it difficult to break bad news?
Sometimes patient comes and asks like, I haven't smoked a single cigarette in my life.
Okay.
I have got.
Shabash, thank you. That is the commonest question asked is, why me? When somebody asks you, doctor, please tell me, I don't smoke, I don't drink, why I got this cancer? So what will you do? You'll tell him about statistics? Are meeting me for the first time, okay? And you have to break the news that my biopsy report says blah blah blah, adenocarcinoma rectum, and I want you to be the doctor and I will do the role of the patient.
May I confirm your name and age, please?
Yeah, so I'm Ashok, I'm 65 years old.
Okay, so what do you want me to call you? Ashok would be fine?
Yes.
If you don't mind?
Yes.
Okay. See Ashok, what I have seen, firstly, I am sorry that actually you were supposed to meet my teacher, but he is on an urgent meeting, he is out of the station. So I am on his behalf on to see you. So if you allow me, then I will first discuss the case reports with you, as because I am seeing you for the first time, and then I will discuss the reports and all the possible management options I can discuss with you, if you allow me.
Sure,
So, okay.
That's fine.
Okay, thank you. So one thing that I can understand, I have gone through your file, I have checked your name, also your registration number, and it shows that you are here to discuss about your biopsy report. Okay, are you getting my point? Okay, but before going to your biopsy report, can I ask you a couple of questions to know you in a much better way, because I am seeing you for the first time. Is that okay with you? Okay, and in the time of the conversation, if you feel free, anytime, if you feel there is difficulty, you can interrupt me anytime, and I shall be very much happy to explain all the things with you. Okay? Okay, fine. So can you tell me more that what the complaint of for which you have to come to this hospital?
So it was about 2 months back. I suddenly noticed that about 2 months back, when I suddenly noticed that I was passing blood in my motion. And I neglected it. I thought, maybe I had eaten some spicy food, I had gone out somewhere, and that may be the cause.
Okay.
But it persisted for another 2 weeks.
Okay.
So I got very frightened.
Okay.
And I went to our family doctor, and then he referred me to your
Clinic.
teacher, Dr. Lala Charangi. And he examined me, and then he asked me to have a test. I don't know what actually happened, because they'd given me something and I was kind of drowsy. And
Okay.
now I've come.
Okay. So apart from this issue, do you have any other medical problem? Like do you have blood pressure, blood sugar, anything? Okay. And any other history of surgery in your tummy or down below in the past?
It's all there in the file, no? Why are you asking me again and again?
Yes, I can check with the file also, but we need to confirm.
Because I told you I'm frightened about what
Yes,
the
I
report
can
is.
understand that. I can understand that. Apart from this, do you smoke or drink alcohol or anything like that? Okay. And whom do you live with? What is your support at home?
I have a wife.
Okay.
I have 2 sons, but they don't live in the country. They're abroad.
Okay, so basically you and your wife are living alone. Now coming to your biopsy report, I have also checked the name, age and also the registration number. I think I have a bad news for you today. So do you want me to proceed with the conversation or you want to reschedule with my teacher the letter? The report says that you have a cancer and the likely that we have a foot passage inside our tummy and the lower part of the foot passage we call it rectum, from through which you have already the bleeding, and we have also examined we have inserted a camera like structure into your that part of foot passage, back passage, and taken a biopsy, and that biopsy report shows that you have cancer of that part. I'm sorry, but the report says so. You can have a water if you want to.
There are a lot of things that are good in this role play. First thing is introduction to the patient. Good morning, Mr. Rao. I'm Gurmeet. I'm the counselor. A lot of times we say, oh, we require to build a rapport. Okay? So, when somebody is anxious, wants to know something, asking questions which are not directly relevant, but later on important, you can ask. So, you build the rapport straight away. Would you like to tell me, you seem to be very angry. First I thought you seem to be upset. Would you like to tell me about it? Then the way he responded, you seem to be angry. And then he explained whatever was happening. And then when he said, I'm afraid, he said, what are you afraid of? I'm afraid of the cancer. What about cancer are you afraid of?
Director of Cancer Center, KIMS Hospital, Bhubaneswar, and he is also a part of this workshop. I would now request him to...
advisor to the Bharti Karnataka.
He is also advisor to Bharti Karnataka Cancer Center and also to another NGO, Amritdhara Palliative Trust. So I now request her to sum up the program.
Any one of you did web-based clinical service during COVID time? No. None of you did it. Okay. It was very difficult. To imagine that from a smartphone a patient is going to converse with me and I have to convey to that patient. Communication जो मैं समझता हूँ for your age has become much more relevant than for my age. Much more important for your age than my age. Why? And it will be still much more important for the next generation than you. Why? Dr. Sarin? Many of you, by the time you are entering into the clinical medicine, have lost touch to communicate with each other. From my childhood, the first thing that I learned was to communicate. Because in the milieu of so many relatives, I have to get the attention to be fed. Next thing is, if we talk about, let's say, confined to that handling difficult communication, there are only few things. It's not something which is very difficult. And don't go by the idea that my everyday practice communication is difficult. My everyday practice communication is largely how I am self-aware. Self-awareness is the first step for communication. Beginning of the day, how you have interacted with the person who is the security person, who has cleaned the room, who has set up your OPD, who is your colleague. And by the time you have done that for first 5-10 minutes time, believe me, by the time you see the patient, you are already in a known surrounding. But if you are just entering into your OPD, or for that matter Dr. Adarsh is entering into his PET city console, probably he is not yet tuned himself. The first thing that you have to do is look at your surrounding for 5-10 minutes before you sit down to see a patient. What information I have or what information I gather. Maybe the patient is the first time you are working up the patient. Nobody else has seen. So you are the first person who is working up the patient. So how much information you gather, and on that basis of the information, what you can say. It might be very difficult for you to look at the eye of the patient. Fine. It's difficult for you to look at the eye of the patient, but look at the shoes. For some time, look at the shoes of the patient and appreciate that. And maybe during the conversation say that, I like your shoes. So observation is largely communication, nothing else. That's what I see. And second part is when it comes to breaking bad news, that requires certain amount of expertise. And that requires control. And that control comes with observing others. You have to minutely observe others, how they are handling difficult situations, or they are handling how to say bad news. And when you have said bad news, never say that I will not accept anger, I will not accept denial, I will not accept somebody like Mr. Rao insisting that call your doctors today and bring all records today. Accept all those things and don't think that those things are something which comes out of the blue for you. Those are expected things. Are you not handling it? So you are handling most of these things, and don't think that these things are something unusual. Only thing is that that person is a little unknown to you, and the moment you are a little self-aware, you learn it. I always consider the most difficult thing for me is when somebody enters and after some time he or she says that I am the son of the patient, or I am the wife of the patient, I have not brought him or her, she is sitting outside, I don't want to tell you anything. Amongst all things, that is the most difficult thing for us to handle. That is also part of what you call as your socio-cultural this thing. Because in your day-to-day life, also you see that even if you are for 20 years married and you are having your family, but if your parents are staying, they are controlling you. And you accept it as your socio-cultural responsibility. So our socio-cultural responsibility also in our context is to handle that thing. My clear request will be news, breaking bad news, anger, denial, collusion, acceptance. Kindly understand these things as part of our cancer practice. Each of those are separate subsections for the communication. Each of these are separate, just like your record keeping. Patient's identity, chief complaints, history of present illness, history of past illness, history of say tests done, this diagnosis. Similarly, communication has all these subsections, and each of those you have to have some. So what exactly is collusion? I said that that is the most difficult thing for me for last 35 years. Before that I had my residency, 35 years or 38 years, I am a faculty. That means you and I have talked something that tomorrow she is having a good purse, we will take it. She doesn't know it. That is collusion, nothing else. Collusion is two brothers bringing the father to tell that पिताजी को कुछ नहीं बोलना है, उनका इलाज चल रहा है 6 महीने से, वो कीमोथेरेपी लिए, रेडियोथेरेपी लिए, अभी सर्जरी के लिए डॉक्टर साहू के पास आए हैं, उनको सिर्फ बताना है कि सर्जरी करूंगा जी, आपका पहले क्या हुआ है मुझे तो पता नहीं है. How can that be possible? That means you and I as brothers are thinking that my father is not knowing anything for last 6 months. Before a person lives, I always feel on a day-to-day basis that before a person leaves the outpatient, or before I have completed the ward round, or before I have discussed with a colleague, that there has to be certain degree of understanding between the two. Even if in your rushed atmosphere you have done it for 5 minutes, there has to be an understanding. And if you leave that understanding, even if the person is in pain, even if the person is not knowing that after the chemoradiotherapy for a shear rectum surgery is not possible, or the chemotherapy has not shown response, but at the end of that conversation, leave it in a manner in which the other person is as self-aware about the situation as you are. And that is an art. How? I will give you examples that many of the palliative care patients who have seen me briefly, their relatives remember me more than those who have been cured. Believe me. Those who have been cured and may see me after 20 or 25 years in some occasion rather embarrass me by telling that we have been treated there, you did this, you did that and that. But whereas the son or daughter-in-law of a patient who has died after 3 months of palliative care, and their attachment gives me better understanding of what is my cancer world. Communication is how you leave an imprint on the other person. Communication is what you at that given point of time, in that circumstance with another person one-to-one or with 5 persons have communicated. How you will see how collusion itself can give pain. And the moment the patient learned that she has this disease and this is what had happened, how by the next day the patient felt that she doesn't have pain. Thank you.
Summing up the session, thank you so much. And I would now request Professor Sukhdev Naik to felicitate sir. It was really a wonderful session, and you make it so interesting and interactive all throughout. Must have enjoyed, and it will be of immense help for your
reading.